We are now live. You can begin.
Okay, it is 9:30. I will call this open session of Lambton County Council to order for November the 4th. And I would start off with a moment of silent reflection. And a week from today is our Remembrance Day, and we have to give thanks for our safety and freedom. Thank you. I would remind everyone that we had an in-camera session and reminded council of a pecuniary interest. And I would ask the clerk to raise a report regarding information from in-camera session.
Yes, good morning, everyone. County Council did meet in camera this morning starting at 9 a.m. and addressed three matters. One, it approved minutes of its in-camera session of October 7th, 2020. Secondly, it approved the minutes of its October 21st County Committee P.M. minutes. And thirdly, it addressed and considered a matter subject to ongoing litigation. That's all I have to report.
Okay, thank you for that. Item number 7, we have update from our medical officer of health. I seen Dr. Ranade had joined earlier. Welcome, Doctor. No, I can't hear you.
How about now?
That's better. If you got a little more.
I'll try. I'm at 100%. Maybe I'll just
There you
talk
go.
loudly.
That's
Okay.
good.
Okay, great. Thank you. Thank you, Warden. So, sure. So I will give my update today. It is a mix of me talking and screen sharing, so I'm going to see how that goes. We'll give you a little update on COVID in terms of the cases and tell you a little bit about our reporting, as well as talk about Ontario's plan that just came out the other day. So locally, I would say our situation remains fairly stable. We've had one case in the last 24 hours, but again, it's just gradually sort of cases here and there. Our total is currently 374 cases with 344 reported resolutions of disease. So people who have recovered or been resolved or cleared from disease. So that is a stable situation right now. Last week we had one institutional outbreak that we declared over, as well as a workplace outbreak that we declared over. But at the end of that week, we declared one more institution into outbreak. So we're now waiting to see if there's any ongoing transmission from that. But so far we haven't seen that. And so I would say right now, stable and watching and waiting is the overall kind of assessment of the situation. I do want to highlight for you a reporting change that we're going to be instituting as of tomorrow, which is that in order to align with the provincial reporting structure and framework, we're going to be reporting our cases the next day, as all of the other public health units do, and as the province does as well. So rather than having our updates go up the same night in the middle of the night, they're just going to be shifted to the next morning. So that's just to align with basically what everybody else is doing. And we'll have a media release about that to provide more clarity to our stakeholders and other partners so that they know what to expect, and that will be changing tomorrow. The bigger thing that I want to convey to you, and this is going to require me to share my screen now, so I'm going to hope that that works. Let me see if that is successful. Can you see my screen?
Mm-hmm.
Okay,
Yeah.
great. So this is, rather than paying attention to the cases that we have locally, I think it's also, because as I said, that's just sort of little blips here and there. We get some cases here and there. It's really important to pay attention to the overall trends that are happening in Ontario, right? So you see, starting at the beginning of September, a large increase in cases day by day to somewhere over here late October, reaching the 1,000 cases by day. And now we're sort of hovering somewhere between 800 and 1,000 or more cases every day. That is important and concerning for two reasons. One, the daily case rate is much higher than we were seeing in the first wave, right? And the second piece to that is that I think the strategy has changed, right? If we had somewhere around here, there were lockdowns and you started to see cases going down, I think the lockdown strategy or the broad lockdown strategy is not being pursued. And so what we have now, and I'm going to see if I can bring your attention to this. Hopefully you can see that now. Do you see something different on your screens? Oh, okay. Okay, hang on. I will have to stop screen sharing and reshare a different screen. So let's see if that works. Do you see that?
Yes.
Okay, yeah. Great, thank you. So yesterday, the province announced a framework that is sort of a gradual graded approach to changing restrictions based on epidemiology and other indicators that are local. So now we've moved from a broad everybody shut down to a more localized, tailored, focused approach based on where cases are and where you see changes in cases. It is a 5-step approach, right? There's green, yellow, I don't know, darker yellow, orange, call it what you will, red, and then full lockdown, right? Full lockdown is what we experienced in the first part of this wave, in the first wave. So it's, they're calling it a return to a modified stage 1 or a pre-stage 1. Control measures are something like a stage 2, and in between there are these three categories: prevent, protect, restrict. Prevent is where everything seems to be okay. You're just focusing on education and awareness, and your restrictions are fairly permissive in terms of what you can do. Protect is somehow enhanced in certain ways depending on the setting, and so there's all of these there's a slide almost for different settings, and restrict then is a larger set of measures that you do before you move to broad scale measures of control. So we're still going through it. The document is fairly there's some complexity to it in terms of what's different among the stages. I think the important thing that you folks need to remember is that currently nothing changes for us. Our numbers are such that we are still in the green, in the prevent, in the standard measures. So most things that are allowed to happen across the province continue to be allowed here. And then our focus would be to help stakeholders understand what would happen if we needed to switch over to protect. For some people, it wouldn't make much of a difference. For others, they might have to actually change some of the things that they're doing. So we're gonna, just as every time new things come down from the province, we review them and then we work with our different stakeholder groups to ensure that they understand them and are prepared for whatever changes may need to happen. You'll see some areas already listed under the restrict, and those are the ones that you would expect. They're places in the GTA where you have high numbers, and so let's just talk briefly about what are the strengths of this. The strengths of this model are that there's a predictability to it. You can understand what some of the decision making is, how it's done, and how you would move from one range of restrictions to another. Nothing's perfect, right? So the limitations of this model are potentially, one, is it enough, right? That's always going to be a question. Is it enough? The second question too is if this is being done by jurisdictions. And I've talked about this months and months ago when a jurisdiction by jurisdiction approach was considered, is that you're always then going to have the challenge of people moving back and forth between jurisdictions where the restrictions are slightly different, so that people might go to one area where they can do something in order to do that. And it's important to remember that at this time, I do not believe that any restrictions are being considered based on travel within the province to different areas, right? So strengths and weaknesses, but I think the important thing is we have some predictability now around what are these different steps and how do they work, and it'll be about implementing them and working with the different stakeholders in our community to implement them. So that's what those are the big things around COVID that are happening right now, that I wanted to bring to your attention. And the very final thing is sort of non-COVID. I'm just going to sneak that in there. I'm going to go back to my screen here. Oh, how do I do that? Hang on one second. Anyway, I'll just keep talking while I'm trying to do this, which is just one thing I wanted to briefly connect with you on, which is that we have a very significant Salmonella outbreak that we've reported on and that we've been following. There are at least about 24 lab confirmed cases to date, over 100 people who we consider probable cases based on their telling us that they have symptoms and their exposure. And a few hospitalizations as well. So this is another serious infectious disease that we are working actively to control. It's local. So far, there's no indication that the spread of this is beyond our borders or our jurisdiction. But we're certainly working to investigate further, establish if there's a source, which we've not really been able to do yet, and then work with the setting to work towards their eventual reopening, as well as making sure that people know to seek healthcare if they have particular symptoms. So we've let all the people know that need to know in terms of identifying the potential symptoms, doing testing as indicated, etc. But I just wanted to keep you aware of it because it is a significant outbreak in terms of its size and also a little bit in terms of its severity. Some people are getting very sick with this. So I'm going to leave it there, except for some reason I seem to be unable to stop screen sharing, which might be a technological problem. So, oh, here we go. Okay, hang on. I think I can do it. Oh, maybe I'm not sharing anymore. Am I still sharing?
No, you're back.
Okay,
back
perfect.
that I can see around. So.
Okay, great.
Thank you for that update. Any questions from anyone? Councillor Bradley?
Yes, Doctor. Two questions. What time will the statistics be released starting tomorrow so that we can plan to look at them? What is it going to be, 9 o'clock, 12 o'clock?
It will be by 11 o'clock. So the intention is to have it updated by 11 o'clock from every day.
Okay. Second question, which was discussed yesterday. Salmonella outbreak, location and numbers are identified, and the difference between what's happening with COVID where there's not disclosure. You gave us an explanation yesterday. Can you give that explanation to the full county council? Why disclosure on one, but not on the other?
Sure. I mean, I think it's important to remember that the disclosure is actually very similar for both. We're disclosing numbers of cases and we're disclosing, you know, the broad scope, the epidemiological kind of details to give you a overview of what's happening in that outbreak. The difference, if you're talking about disclosure of setting, that's really based on what we consider the exposure to be, right? So it's disease, exposure, action. This is a foodborne disease. We know that the exposure is having eaten the food. And so in order to identify people who might have been exposed, who may need to take action, we identify the place where they may have been exposed because that was the setting where they ate the food. If there was a different kind of exposure, we would judge that based on our risk assessment and our understanding of both disease and exposure, as well as the actions that we might ask people to take, and then make a decision about what information to disclose based on that. And so that's why you might see some differences in what's reported.
Thank you.
Okay, Councillor Loosley?
Thank you, Warden Weber. I also just wanted to mention, as a comment, it's been brought to my attention as well, after with the salmonella. I mean, the whole country's been informed and notified, and also I'm being questioned why it's not being handled or why the COVID-19 was not being handled. So I appreciate, Doctor, you trying to explain that, but it's very difficult for the public to say, oh, we notify everyone for this, but we don't for the other. The other thing I'd just like to comment and ask is when there is an outbreak, if we could mention, and maybe you're doing that, but I haven't heard it, if you're mentioning the actual regions that are affected, if that could be mentioned at the same time as well, I think that would be a good idea. Thank you.
Sorry, I just would like to clarify that. Are we talking about COVID or salmonella?
We were talking about both. The first part was the idea of comparing salmonella to COVID-19 and how we notify and giving out the information and not keeping it the same. The second part is when there is an announcement with an outbreak, and maybe I've missed something, but I don't hear where we've announced what regions are being affected. And I'm just wondering if we could do that when you make the announcement. If there's an outbreak, you could say it's affected in region number 1 or whatever.
I believe he's asking whether the map is being updated as we go forward, and
Okay, sorry, I'm still a little bit confused. So when we talk about the cases of COVID, we do assign them to the geographic regions that we've specified, and so all of the cases are connected. If there's a particular outbreak in a setting that we identify, such as a long-term care home, then that would be known, but there's no real way of linking that to the map because we only link cases to the map. So they would show up there because they're cases, but there's no real other way to that I can foresee to link an outbreak to a region. The other problem with that is that in most cases, the outbreak is not really contained to the region. So identifying that, so if you have potentially a workplace that's in one part of the county, but people at that workplace live in all parts of the county, you couldn't really say that it was this region that was affected. So I think that's one of the challenges around identifying a specific region where COVID might be, right?
okay. Councillor Stark?
Yes, Doctor. Going back to the Salmonella, you know how the restaurants are color-coded, green, yellow, red. I presume this particular restaurant has been designated red currently. My question is, as it comes out of that red designation, will the public be advised by way of a yellow color to indicate that caution is needed? Or could you explain to me the transition of color grading?
Sure, I'll try. So the green, yellow, and red are really linked to different estimates of risk at the time that the inspection was done, right? So when a facility reopens from something like this, it may very well be right in the green. It would have a reopening, there would be an inspection around it, but you might not say that there's any residual risk there. So it's very possible that a place would open up again and be green. It's possible that it would be yellow, but based on this, we probably wouldn't open it up unless we were comfortable that it would be green again. And so what you're probably going to see, just to set that expectation, is that as soon as it opens up, that it would be green because it would have been inspected. I'll have to clarify whether or not that inspection is done, but I think it probably is before reopening. So the two are linked, but not necessarily. I mean, I think you could say that it's red, but it's also closed, right? Red is when we make something red, we actually close the facility. So it's red and closed. When it's open, it might be green because there's no residual risk.
Okay.
Thank you.
Any other questions for Dr. Renedy? Councillor Rombout?
Yes, thank you, Warden Weber. Dr. Renedy, I'm just wondering, you showed us a chart with Ontario's cases and they obviously have increased. Is the number of deaths following that chart, or are we seeing a decrease in deaths and hospitalizations? You're muted.
Sorry, I will show you that right now. And so this is, see if I can share this screen again. Can you see that? Everybody went blank. Can you see this? Oh, okay. Yeah. Okay, great. So if you follow the trends of deaths, you can see that they're not the same. It's not the same pattern that you're seeing in cases. There are two suggestions for why that might be. One is that largely the cases that you're seeing are in a population that is less likely to die. Okay, so you're seeing cases in 20 to 50-year-olds or even younger, and they're far less likely to have a severe outcome like mortality from this disease. And so that's one of the reasons. The other reason is that deaths are widely considered to be a lagging indicator, something that happens later after you have lots and lots of cases in the community. So So there are some people that are saying the deaths are not going to go up because it's mostly confined to a particular segment of the population that is at lower risk of death. But that segment of the population also interacts consistently with people who are older, who are at greater risk of death. And so it's possible also that the death indicator will start rising later. So that's kind of the waiting period that we're in to see whether or not that's going to happen. But those are the two kinds of explanations about why that's different or why that's not happening.
Okay, thank you.
Thank you. Any other questions for Dr. Rennerday? Seeing none, thank you, Doctor. Our next mayor's update, I believe, is next Tuesday because of Remembrance Day on Wednesday. So we will let you carry on with the good work you're doing and keeping us safe. And thank you very much.
Thank you.
Item number 8 on our agenda is donor recognition. And we know firsthand the benefit of living in a community that cares. Approximately 1,500 donors give annually to enhance a wide array of county programs and services. These charitable gifts help provide the high quality and affordable services that respond to the needs of our communities. This year, we had some very generous donations made. Linda Smith donated a tri-shop bike to Lambton Meadowview Villa. The Seaway Kiwanis Club continued to support Lambton Circles. Their continued support over the last 10 years has helped enhance the programs and services offered by Circles. The Sarnia Community Foundation provided the long-term care division with funds to purchase iPads for residents living in the homes. The Villa Auxiliary, Lodge Auxiliary, and Manor Auxiliary all provided support for their respective homes. Also, this is the first year the Manor Auxiliary has received charitable status. Great work and congratulations to all of those that support our homes. The estate of Jean Muma bequested over $34,000 to the Lambton Heritage Museum. Charles Fairbanks and Pat McGee of Fairbank Oil Properties donated $7,750 to the Oil Museum of Canada Historic National Site. This donation will support an upcoming international conference contributing to the Robert Cochrane Memorial Fund and covered the cost of the guided wagon rides through the historic oil fields surrounding the museum. That's an upcoming international conference. Rob Brooks donated an extensive collection of silent film era posters to the Lambton County Archives. Ron Van Horn and Scott Ferguson continued to support the Judith and Norman Alec Art Gallery. Their donation will help enhance programs and services offered by the gallery. On behalf of Lambton County Council, I would like to extend a sincere thank you to all the donors who gave generously given to the County of Lambton this year. Very worthwhile, very great community we live in. Lots of great support across the county. And also the Lambton Online Community Association or CA donations will be coming live after this, and there's some videos that are there recognizing the people that have made these contributions, and you can watch them online. With that, the minutes of open session from October 7th. Is someone prepared to remove those minutes? Councillor Rumbouts and Councillor Han. Any questions or discussion regarding the minutes of October 7th? Being none, all in favor? Opposed? That is carried. We have correspondence. There's a recommendation to receive and file from the, there's two pieces there, I believe. One dealing with gypsy moths and the other with impact of building closures. Moved by Councillor Bradley to receive those, second by Councillor Miller. Councillor Bradley, have a question.
Yes, I do. Mr. Warden, I went through the gypsy moth correspondence. Who is going to, and I understand why the county's involved because of the property up there in the Port Franks area. Is the expectation the county is going to be involved financially in supporting any spraying in that area?
I believe Mr. Cole has had some discussions with this. Lambton Shores is still looking at a report coming in this fall, and I don't know whether there's any indication at this time whether the county is going to be financially spraying a part or of our
That's the
land.
only point I want to make is the city paid $90,000 to do the spraying at the lower level, and just want to see if quality and fairness, if that's the case, if the county's going to get involved financially in the spraying.
Okay, Mr. Cole.
Through you, Mr. Warden, I can maybe speak a little bit to that. So just as a follow-up to our July 8th report to council on the gypsy moth situation, especially in the Port Franks and Grand Bend area, we have been meeting with the local conservation authorities as well as municipality of Lambton Shores and Plimpton, Wyoming, in order to just review those issues in those areas. And our current scope, I think, at the county level is that we own 600 acres of natural land up in that area. So determining what we're going to do with that, as well as the Heritage Museum property, which is another 12 acres of heavily wooded lot. And right now, I think it's how we manage those properties in conjunction with whatever the municipal response is and community response.
Yeah, I understand that. I mean, there is a direct interest for the county, but I do think there has to be fairness. If the lower tier does it, and the upper tier is going to get involved, then other areas that are looking to spray should also receive some financial support from the county.
Okay. Councillor Ferguson.
Just a question there. When I go back to the emerald ash borer, that was not sprayed as a bigger issue. But I look back as a landowner myself with woodlot. I don't have the gypsy moth here. I have the wrong type of woodlot. Also, the farmers go through, and we do have pests come through our properties too. We all pay for that privately. I do hope that one thing to coordinate to bring in the sprayer to do everybody's property at once. But I would kind of drag my feet a bit in having us pay for private property. I don't looking for us paying for county property with that, because with our issues in the county, when we have pest infestations, we pay for that ourselves on our properties. Thank you.
Thank you for that. Councillor Napper.
I recall this back when we first discussion, and I thought it was more of an information thing, and we was very interested in, like, with our own parklands there as to how to move forward. I believe it was Mr. Cole. I think we had some correspondence on that, and to come out and let people know what is available to them. And I said, as I said, I think we'd be interested in with our parks and stuff that we got out there.
Okay.
So through you, Mr. Warden, I believe your Public Works Department has been involved in these discussions and copied on these communications. There is a private sprayer who has engaged many of the community partners as well as ourselves in this matter at this time. But right now, the county has not made any commitment, and frankly, the province hasn't released their gypsy moth assessment this year, and as of yet, and we have committed to work with the Conservation Authority to do a gypsy moth assessment on our own properties at the county at this moment to see exactly what those impacts are expected to be.
Okay, Councillor Stark?
Yes, as a follow-up to Councillor Bradley's comments, I agree with him that if we're looking at a county-based study that envisions financial compensation that to the lower tiers, that we would want to make sure that the entire county is looked at, not just the northern section along the lake, but given the fact that the city of Sarnia is also looking at an expansion of spraying because others within the city were not covered the first round. There is concern that the gypsy moth infestation is going to be more expansive. So my point is, if you're doing a study, I would want it to include the entire county and the expectation that a revisiting of financial compensation for what's already been done. Just a comment more than a question.
Councillor Cook?
Thank you, Warden. I guess my expectation or understanding was that the county would only be involved to the extent that their private lands, or pardon me, county-owned lands abutted private lands. It wouldn't be extended into the areas, for example, inside a inside a municipality where they did not own any land. And the cost, if there is any, to the county would only be the areas that they would spray adjacent to private landowners, as opposed to spraying across the whole county. Unless I'm wrong, I think that was the understanding when we did the initial thoughts of moving forward in our area.
Thank you. Follow-up, Councillor Stark?
Yeah, and I tend to agree with Councillor Cook that my comment really related to the study in general, that I want a delineation of what the expectations of the county are as it relates to financial support. And as Councillor Cook indicates, it's important that we understand exactly what we're being asked should financial compensation be involved. Thank you.
Thank you. We'll get more information on this as we go forward, but I do believe the general thoughts are that if the county sprayed, it would be county land only that the county would be spraying or spending dollars on, not private land or not public land. So, any other questions? The correspondence will be received. All in favor of that? That is carried. Thank you. The Cultural Service Division, number 11. A is the Canatara Log Cabin Transfer Agreement report. There's a report here with a motion, recommendation. The County Council endorsed the transfer agreement between the City of Sarnia and the County of Lambton related to the relocation of the Canatara Log Cabin, and all costs associated with the relocation of the cabin are assumed by the City of Sarnia and its partners. Moved by Councillor White. Is there a seconder for that? Councillor Cook. Any questions regarding this? Mr. Meyer, do you have anything to add? I believe the report is self-explanatory.
Thank you, through you, Warden. No, nothing substantive to add. I guess just a comment to emphasize that in terms of setting expectations, Council will be aware that we do have several properties on the site, 5 historic buildings to be precise, that are in need of significant restoration work themselves. So just in terms of setting expectations, we recognize that restoring this cabin may be an effort that takes several years, and it will be at the pace of the success of the fundraising efforts by the advocacy group. So just putting that out there. It is in the report, but just in terms of we won't see this restored immediately. It is a long-term project.
Okay, thank you for that. Any other questions? All in favor of the recommendation? That is carried. Thank you very much. Item B is the court services lease negotiation update report. There's also a recommendation with that report. A 2-year lease agreement, execute the document and approve the bylaw. Moved by Councillor Busse, second by Councillor Bean. Are there any questions regarding this agreement? Councillor Napper?
Yeah, is there any thought if this really works out well that it would stay there?
Gerald?
The initial plan is basically to relocate them to Bayside after. So this is a temporary move. That's why we've gone with the 2-year lease that you have in front of you. But there's all, you don't know what's going to happen in the future, right? So.
Okay. Councillor Cook?
Yes, thank you. Through to Larry. In the report, it says to terminate on December 31st, 2021. Should that be 2022 in the report? I'm assuming that the contract would say 2022, but the report says 2021 for a 2-year lease.
Our intention is basically a year lease with a 12-month renewal for full 2 years, because basically we're hoping to have Bayside up and ready by early part of 2022. So that's sorry for any confusion, but it's a 1 year with a 1-year renewal.
Yeah. Perfect.
Thank you. Any other questions? On the question, all in favor? That's carried. Thank you very much. On to committee minutes. The AM committee, Chair White.
Thank you, Warden Weaver. I present to you the committee AM minutes for October 21, 2020 for council's consideration.
Item 1, infrastructure development information reports. Item 2, intersection control treatment. Item 3, county winter operations. Public health services. Item 4 is correspondence. Item 5, information reports. Cultural Services Division. Item 6, correspondence. And item 7, information reports. Councillor White.
Yeah, thank you. Just wonder, just for discussion, because I'm still getting actually more questions than I expected regarding the library reopening. Would Mr. Meyer just kindly provide one more time just a quick summary of what the reopening plan would look like, and for my benefit, specifically for Sarnia Public Library?
Absolutely. Through you, Warden Weaver, and thank you for the question, Councillor White. We do have an information report coming to the next committee, November 18th, specifically dealing with the Sarnia Library, but I can provide a quick update to the group today. We've been informed by City of Sarnia staff that we're several weeks away from the heating, ventilation, and air conditioning renovation at that site. Obviously, a functional HVAC system is critical to activating services at that site, particularly during COVID with some of the recommendations concerning ventilation. So we have delayed our start date for both curbside pickup and limited public access for public computer use, Wi-Fi use, academic research. As we've implemented at other branches, we've delayed that at Sarnia Library until the renovation work is complete. We have recalled the staff that remained on indefinite layoff in Sarnia Library have been recalled effective November 9th. So that's this Monday, in anticipation that that work will be completed within the coming weeks. And we suspect that by mid-November, we'll be in the position to at least offer curbside pickup at Sarnia Library. So a lot of this will be communicated in the next committee report, but it will unfortunately fall a couple days too late beyond our plan. So we hope by mid-November to have curbside pickup activated at Sarnia Library. We also intend to make the theater available for use, limited use, as per the stage 3 restrictions implemented by the province. However, public access may be a challenge at this time until the building has HVAC fully restored. Currently, half the building has a functioning heating system. The other half is still in the works. So what we suspect is within the weeks following, possibly into December, possibly later, then we will allow public access into Sarnia Library. So I know the city has experienced some unanticipated delays with the contractor involved, and that has caused the delay in starting up services at that particular location, but we are very close.
Thank you.
Thank you for that update. Corporate Services Division, item 8, information reports. We have no in-camera session. Item 9 is adjournment. Chair White.
Thank you, Warden Weber. And I present to you Committee A minutes for October 21, 2020 for council to receive and file as printed.
Seconder for that motion, Councillor Ferguson. Seeing no further questions, all in favor? That is carried. Thank you very much. PM minutes from October 21st, Chair Rombauts.
Thank you, Warden Weber. I present to County Council the Committee PM minutes dated October 21st, 2020.
Start off with Long-Term Care Division information reports. Motion 1. Corporate Service Division information reports. Motion 2. Item number 3 is Finance, Facilities, and Court Services information reports. Item 4, Social Services Division information reports. In camera, item 5, 6, and 7. Item number 8, open meeting motion. Item 9 is adjournment. If there are no questions, Chair Rombauts.
Thank you, Warden Weber. I move that the Committee PM minutes of October 21st, 2020 be received and filed.
Seconded by Councillor Arnold. No further questions. All in favor of those PM minutes? Carried. Thank you very much. I do not have any items tabled from a previous meeting. We have no notices of motion. Any other business? Councillor Rombauts.
Yes, Warden Weber, thank you. I just want to inform County Council that I will be throwing my hat in the ring for the election for the deputy warden.
Okay, thank you for that. Councillor Hand, I've seen your hand up.
Just a question. So I think we do not meet for committee in December, but I'm not certain. So would we be going to new committee in January as per the assignments?
Yep.
That's correct. Thank you.
Correct.
Thank you.
Any other business? Notice of bylaws.
Yes, thank you. It's moved by Councillor Hand, seconded by Councillor Cook, that bylaws 31 and 32 of 2020 as circulated be taken as read a first and second time.
Questions? All in favor? Carried. Thank you.
Thank you. It's moved by Councillor Cook and seconded by Councillor Hand that bylaws 31 and 32 of 2020 be taken as read a third and final time.
All in favor? Carried. Thank you. And we have adjournment. County Council will meet again on November the 25th. And as I mentioned earlier, the Remembrance Day services will be quite different this year, but urge people to not forget. We will remember them, and I would call for a motion to adjourn. Councillor Napper and Councillor Bean. All in favor? That is carried. Thank you. Stay safe out there, everyone. Look out for each other.
Thank you.
Have fun, both folks.